with our lifestyle, we are not eating home cooked foods. So we are getting packaged foods. Lot of sugars, lot of trans fats, which is not good, high salt content, lot of additives and preservatives. Now these can lead to a lot of damage to your body. And junk food is addictive.
Welcome to 21st episode of Aarogyam Katta. Today we are going to discuss diet, exercise and posture. Probably all these subjects are relevant in today's time. To discuss on this, we have Dr. Shalini Mukherji. Welcome, Dr. Shalini Mukherji. Now, Dr. Shalini Mukherji's career path literally surprises me because I know she was a practicing dentist and doing very well. And suddenly I have found one day that she is now health professional. Why did migration happen? How did it happen?
So yes, I enjoyed doing dentistry, but one of the hazards of the dental profession is a bad posture because you are bending forward. In those times, 20, 25 years back, we did not have the microscope and we would turn our head and look into the teeth. And I developed a scapular injury, that is a shoulder blade injury, which was not getting rectified. So I got interested about rectifying it myself. I did the rehabilitation course with the Functional Training Institute Australia, and I was already working out and exercising, and then I started doing courses in exercise. I got into nutrition, I got into rehab, I got into mobility, and I suddenly switched lines. I started doing both together, but then I started enjoying this more, and now I'm completely into health professional. I retrain muscles post injuries. I give nutrition plans, and I'm a posture specialist.
Okay. Now tell me, the diet, the exercise, the posture, are by any chance they interlinked or they are three independent things?
They are definitely connected. So your posture decides your breath, it decides the state of your mental anxiety, fear, or happiness. And when you're eating in the wrong posture, you may release some kind of stress hormones like cortisol, which will affect your digestion. And if you're in the wrong posture and you're exercising, you may not get the benefit out of it. So, posture is an integral part of health, and we definitely need good nutrition and movement patterns to keep us healthy and strong.
Okay, thank you. We hear the word when we were school children, we were hearing physical training, PT popularly called as.
Correct.
Then as we grew, we got into yoga. We heard the word exercise.
Correct.
Then we heard the word yoga. Then come meditation. Now, what is all this? Can you explain briefly what all these terms are? Are they the same? Are they the same horse being called differently, or they're completely different? And nowadays we also hear power yoga.
Correct.
Okay, there are so many types of yoga, but even power yoga is happening now.
Right. Essentially, on a broad scale, they are all movement patterns, right? But it affects our system differently. For example, exercise, it stimulates the sympathetic nervous system, that is a fight or flight mode. Your heart rate goes up when you exercise, your breathing goes up, your blood circulation increases, and your digestive secretions come down. Your blood pressure goes up. Whereas when you're doing yoga, it stimulates and activates your parasympathetic nervous system. So your blood pressure comes down, your heart rate comes down, the blood vessels dilate, and your digestive secretions increase. Exercise is more of goal oriented, whereas yoga, there is more of internal awareness of your breath and the infinite. So the goals for each are different, but they are essentially movement patterns. Both work towards health.
I see.
Yes.
Okay. Now, what's the difference between the general well-being and these days general well-being is heard a lot. I think it is a comprehensive well-being, not only the mental health but even physical health. And what is that general well-being?
We were told that after a certain age you put on weight, so you have to exercise to be healthy. But looking at our lifestyle, there are so many stresses. And if we are not sleeping right, even if you eat right and exercise daily, you will not see the benefit and there will be harmful changes in your body. So, a general well being is a state of health where you're physically, mentally, emotionally in a healthy state.
That's it.
So, we have to look into our daily routines, we have to look into our sleeping patterns, eating at the right time, moving at the right time, and eating according to our activities. You know, in the olden times, we would get up, probably walk to the bus stop, take the bus, get down, walk to our office, move around. Here, we are sitting at home, we take the lift, we sit in the car, we sit at work, come back sitting in the car, sit in front of the Netflix, and we go to sleep, right? So our movement patterns have reduced.
Okay.
And that is the reason of all the problems of this lifestyle.
Does the diet influences on health and longevity?
Definitely, diet is a major part because if we kind of create an analogy between a car and a human body, you send your car for servicing, you ensure that you're putting in unadulterated fuel into the car. So we need to constantly keep moving to increase the blood circulation. That is your servicing. And we need to put the right kind of fuel into our body. So good balanced nutrition is very important. And if that goes in, our organs are healthy and our longevity goes up.
Thank you. Now, I have read somewhere that most of people don't eat breakfast, lunch, and dinner in an appropriate sequence. Somebody says carb should be eaten, somebody says fiber should be eaten first, somebody says what is the theory for like breakfast? What can the fruits be a part of breakfast or the lunch or the dinner? Because many nutritionists say that fruits are separate; they have to be eaten on standalone basis. Now, what's your take on this?
It depends on your activity of the day. Say you have exercised and come in the morning. You have burnt calories, your blood sugar has dropped. You need to have a fruit because fruit gives instant energy. It gives you fructose with high fiber. But if you're just got up from sleep and you're having breakfast, then a sudden rush and increase of sugar in your blood can cause insulin resistance. So you rather have a healthy, wholesome breakfast like whole grains, good portion of protein, good fats as a combination.
Are there bad fats and good fats?
Yes, there are.
Okay.
So your
thought all
process.
fats were bad.
No, you need fats. Your brain is made up of cholesterol. It is fat. All enzymatic reactions in the body need fat. You need fat for digesting all your fat soluble vitamins, your vitamin A, D, E, and K. So if you're not having the fats, the vitamins from the vegetables, fruits, supplements will not get absorbed. And you go into nutritional deficiency in spite of eating the food which contains those things, right? So it is important you have to have all the macronutrients in your food in every meal. Your proteins, your lean proteins, your complex carbohydrates, and your good fats.
Okay.
Yes.
Now, there's always a problem question whether to do exercise or yoga or exercise and yoga or how long one should work on per day basis. I'm talking about a generation which is 60 plus retired people. We have to focus on senior citizens.
Absolutely.
Because the increase of longevity,
yes,
their population has increased a lot.
Correct.
And younger generation has facility to talk to colleagues. They get a lot of advice from companies and all. But senior citizens don't get that. So, what would be your take? I mean, should it be 1 hour exercise, 2 hours exercise, or 1 hour yoga? Or, I mean, what could be your take?
Anything that we do, we have to sustain it. You cannot do something because you're forced to do it and you lose interest after a month or 2 months and you're back to square one. So if you like walking, walk. If you love doing yoga, do yoga. If you like going to the gym, go to the gym. The key is to maintain your heart rate at the optimum level. If your heart rate goes up beyond the desired level, it is no longer an exercise. It becomes an exertion on the heart, which is detrimental to health. If you don't have time, it is not necessary that you need to exercise an hour or 2 hours a day. Just move through the day. We are born to move. Have your meal, walk around, go down the steps instead of taking the elevator. Go to the grocery store instead of ordering on Zepto or Blinkit. Take your dogs for a walk. Don't keep a dog keeper. Do some gardening. Sit down, get up. That is called as NEAT, non-exercise activity thermogenesis, which you keep doing through the day. That burns more calories than 1 hour of exercise.
Is that so?
Yes.
I see.
So if you walk around through the day, you move through the day, you're not seated, you're doing things all through the day, especially after meals, you're good to go.
I have seen some people which don't do anything, but as you said, their activity levels are very high. Physical activity, not physical, but their walking,
The daily
going,
movements.
daily movements are very high.
Yes.
Is that adequate?
Yes. You see your maid coming to your house, she's not overweight.
Never.
Because she is doing a lot of physical work all through the day, right? So there is constant calorie expenditure, and that kind of takes care of the food that is coming in, the input and the output. If there is a deficit, you don't put
Then
on
that's
weight.
a problem.
Yes.
Okay, now since you have spoken about calories, now when I eat, I don't know how to measure calories. Because doctors say, okay, 17 or whatever is the
Correct.
amount of calories you should consume. But how to measure calories that I am taking?
Do not measure calories.
Okay.
Be mindful of what you're putting in your mouth. So have a relationship with your food. When you're sitting and eating, do not be on the phone, do not be watching Netflix, because you don't realize how much food is going in. Eat slowly, chew well, and as you eat slowly, there are lots of hormones being secreted by your stomach. It sends a message to the brain, to your satiety center, okay, we are 3/4 full, and you will get the signal. Listen to your body. Chew well, eat slowly, be happy when you're eating, don't be in an angry conversation with anyone, and you will be fine. You don't need to count calories.
So when you say chew well, that means the dentistry plays also a role in
Definitely, definitely, you have to have a good set of teeth. We are born with 32 teeth now, 28. Most of us have 28. And there is a very important role of the grinding of the food and the mixing of the saliva into the food that comes in. It forms a bolus. So, a starting of digestion takes place in the mouth. Once that happens and that goes into the stomach, the load on the stomach is less. So if we do not eat well and chew well, the saliva is not mixed with the food and the stomach gets overloaded with work and it goes into heartburn. And that's when you have indigestion. Yes.
Can you guide us for 5 minutes or 10 minutes of exercises which can be easily done no matter where you are?
Absolutely, I can show you. So if you are on the phone at work, walk and talk. It could be just walking 5 steps forward, 5 steps back. If you're on a video call, you are sitting and only from your waist up is visible. There is a lot of movements that we can do with our legs. Now, the calf muscle is said to be our second heart. It's the pump. When we sit
Calf
for
muscles.
long, yes, our calf muscles.
I see.
It's called as the second heart.
I see.
So, it's a muscle which contracts when you move it, right? And that pushes the blood back into the heart. against gravity. But if you're sitting for long hours, there's pooling of blood, and that's what leads to heart related issues, deep vein thrombosis, varicose veins. So, all you need to do is give me heel push ups, push the heel up and down.
Okay.
You are contracting your calf muscles. You can do alternate right and left. You can do both legs together. You can lift your foot slightly off the floor. So you're in front of your laptop. They will not know that you're doing these things. The other important thing to be aware of is when you're sitting, do not slouch. Sit tall so that
I'm
there
in the
is
wrong posture.
So sit tall, see that you have a right angle at the hip, a right angle at the knee, a right angle at the ankle. So you're ergonomically sitting right.
Right.
And automatically your metabolic rate goes up. And you're into greater calorie burn than the other person who's slouching.
Okay, now can you suggest a right posture to sit while spending, I mean, reading a paper or something? Because as I said, we are discussing more on for senior citizens.
Right.
Because senior citizens these days also operate on computer and mobile.
Absolutely, absolutely.
So, what would be the right posture for working on the computer or reading the paper?
Okay. So I'm talking about the right posture. It's a subject which is very close to my heart, and I will be spending a little more time on this.
Don't worry.
The posture is the way you sit, stand, or move. It's not only when you sit. And the posture is defined by your skeletal muscles and the skeletal bones. So if you are into a particular posture over a prolonged period of time, those muscles go into chronic contraction, and that causes a change in your joints. It pulls the joint away from normal, and that's when you go into the wrong posture. So we have two types of postures. One is a high power pose. That means that your torso is nice and tall, your shoulders are open, your torso is wide, and your limbs are away from the central body. The other one is a low power pose where everything is closed in, you're hunching. What happens when you hunch? The length of your torso drops. So if your laptop is here and you've hunched, so to compensate, your chin goes up. So there's a lot of compression of your cervical spine. There's hunching of the shoulders, there's rounding of the lower back, and that can lead to a lot of problems. There's been a research done which shows that sitting in a high power pose increases your testosterone levels, reduces your cortisol levels. Now, testosterone is not only a male sex hormone, it is present in both males and females. It improves the strength of your muscles and joints. It helps in the formation of red blood cells. It helps in increasing the skin collagen. It helps in improving your mood, your confidence. It gives you a sense of stability. Your communication skills are better. And because you're sitting in that tall posture, your rib cage is open. Lungs can expand to their maximum limit, more air going in, more oxygen reaching the cells, improved metabolism, improved calorie burn.
Okay.
Wrong posture. You're slouched in. You're in a fight and flight mode. Your cortisol levels go up, your testosterone levels drop, your immunity drops because of the high cortisol levels. Cortisol can affect the functioning of all the other hormones.
What is cortisol?
Cortisol is a stress hormone.
Stress.
And this cortisol can cause changes in the other hormones. So you land up with thyroid problems, PCOD, you land up with type 2 diabetes because your metabolism has dropped, less oxygen going in because of the compression of the rib cage. Your calorie burn reduces, you land up with obesity, weight gain, and many, many other related problems. Of course, the musculoskeletal problem is there. You land up with compression of your cervical spine, lower back pain, sciatica pain. So, the most important thing when you're sitting, standing, cooking, driving, be in the right alignment of your spine and be in the right posture.
Can we just physically demonstrate what's the right posture?
Definitely. So if I'm sitting, as I said, you need a right angle at the hip. You imagine there's a thread on top of the head. It is pulling your torso up. So you're lengthening your spine, increasing the distance between the vertebrae. You're opening out your shoulders and dropping the shoulder down and having your hands by the side. This will ensure good thoracic mobility. It will ensure good normal breathing. So because good amount of oxygen is going in with each breath, your heart rate comes down. So you're more into a parasympathetic response. Your mind is calm and active. You can take better decisions, right? Wrong posture is when you're slouched, you're in a vulture like pose, your chin is up, you're working, and because you have slouched, your chin goes up, your shoulders go up, you're in a hunched position. There's a lot of compression, your heart rate goes up, and you can land up with cardiovascular issues, with respiratory issues. The list goes on.
It's quite scary. Is there any chance of reversal of the wrong effects of wrong posture?
Definitely.
If you correct the posture, would things be better?
Definitely. There's a whole procedure to it. That's what we do in rehab. Why do people have frozen shoulders? Why do people have sciatica pain? Why do people have plantar fasciitis in the foot? Knee pain, ankle pain, wrong posture. Because when you're in the wrong posture, we were designed, the spine is S-shaped curve. We were designed to carry our weight on our hips and our spine. The minute you get into an imbalance in the posture, you're loading the small joints which were not geared to take your body weight. Your knees, your ankle, and they get overworked and they land up with injuries and stress, right? So being in the right posture is a process. It's a constant reminder. And once your instructor gives you the right cues, you need to even exercise in the right form. Otherwise, you will land up with injuries.
So does it mean that all these three things, that's diet, exercise, and posture, has to be under guidance, has to be under some guru, or we can see videos and do it?
It's an option of seeing videos, but if you have a certified, qualified trainer or a yoga guru, the cues given by the trained personnel will make you do the movement in the right form. Even while you're doing the movement, every rep is being corrected. So initially, you definitely need guidance. Once you have got the knowledge of the right form, and once the right form gets into your subconscious,
Then it becomes.
you can do anything.
Are there any classes around Mumbai where which can, because having one-to-one tuition will be very expensive.
Correct.
So what's
The take
low
on this,
cost options?
again, if you have the right certified instructor, they will see to it that they will not push you into doing 50 reps, 100 reps. Do 2 reps in the right posture and you will gain a lot more from that exercise rather than doing 20 to 40 reps of that movement in the wrong form, which is an exertion to your heart.
Correct.
Right? So we need to go as per our individual body capacity. Do not do what the next person is doing. So do not follow a herd. So we have online classes where they are doing movements without categorizing that this is for this person, this is, yes.
Guru.
So you need to invest in your health. Otherwise, you will invest in the
Spending in
hospital.
doctors.
Absolutely.
So thank you very much. You have really briefed us, and it's an eye opener for us
Thank you.
that nobody really cared for posture. Diet, everybody talks about. Exercises, everybody talks about. But today we have realized that doing the exercise is not the time bound, but the correctness is important.
Absolutely.
Same thing is about diet.
Absolutely.
You can eat, take little liberties
Definitely.
But how you eat, what you eat is more important, and the portions of that.
Portion control is important. And the other factor with our lifestyle, we are not eating home cooked foods. So we are getting packaged foods. Lot of sugars, lot of trans fats, which is not good, high salt content, lot of additives and preservatives. Now these can lead to a lot of damage to your body. And junk food is addictive.
But almost on all the packaged food, there are no trans fats. I think in Sambak.
No. Even if there are no trans fats, if you read, there will be your cornstarch, there will be your fructose, and there are hidden forms of sugars and salts which are there in it. And check the calorie content. You rather eat one whole grain or a millet roti than have a high fiber biscuit, which has been made God knows when. Even the germs don't get in. They are scared, right? You cannot keep a potato out for more than 4 days. It will rot. But you have these frozen chips which stay forever. There must be something in it where even the germs are scared to go in and eat it. Yes? So eat fresh food, eat home cooked food, eat a balanced meal of proteins, carbs, fats. Eat a lot of colored foods because they contain a lot of antioxidants in it, which will help improve your brain health. It will help take away the free radicals which are causing the thickening of the arteries. And be mindful of your food. Be aware of every morsel you're putting in your mouth. Enjoy every morsel of food.
Do you have to say anything on your own, or do you want to show something to people so that they can practice it by looking at what you are doing?
Definitely. As I said, sitting in the right posture, we need to have hip distance between our knees, knee distance between our feet, right angle at the hip, right angle at the knee, right angle at the ankle. Simple ankle pumps, heel lifts. You can do unilateral, bilateral, your choice. You can join your palms to your heart, open your shoulders back and down, and give seated marches. You can even do this on a flight, long hours of flight. You can move your arms up and down, alternate. If you have the space, you can go sideways, otherwise, go into an flexed elbow and back. Lifting your arms overhead elevates your metabolism, improves your metabolism. So just by doing small movements, also if you're sitting for long hours, the lower back is constricted, so you can do some side movements, but see that you're not moving from the neck. You're moving from the waist. So your head is attached to your torso. It will move. Do not separately move your shoulder and neck. So move from the waist corner, center, waist corner. See that you're not moving your knees when you're doing this. And the most simple exercise is to stand up. It's just stand up and sit down. So in between your clients, in between your audio calls or video calls, just do 3 or 4 standing up, sitting down, 4 times, 5 times between the day, any time. So you can add up to 50, 60, stand up and sit down. So by extension of the hip, that is opening of the hip, you are firing your metabolic system. Your heart rate goes up, your exercise movement happens, which engages all the muscles of your body, and your calorie burn goes up. So just stand up and sit down. A very, very simple movement.
So thank you once again, and make some more videos on this, because I think it's so vast topics.
Yes,
it can't be covered.
It cannot be covered in one time.
interview.
That's true.
But we really look forward to your presence in subsequent interviews.
My pleasure.
We'll ask you a few rapid fire round questions, answers of which will be yes or no, or maybe
I will try.
Maybe brief.
Okay.
Breakfast is the most important meal of the day.
The first meal of the day is very important, whatever time it is.
Everyone should follow the same diet plan?
No.
Poor posture can lead to headaches.
100% because of compression of the cervical spine.
Water intake is important for weight loss.
200%.
Crash diets are safe for quick weight loss.
We can take out the word safe. You can have weight loss, but I don't know about safe.
Sitting for long hours affect posture negatively.
Yes, because sitting is the new smoking. You tend to slouch, and that affects your posture.
Exercise alone can compensate for poor diet.
No, diet is a very important part of health, contributes to 70% of your internal organ health.
Stretching is important before exercise.
A warm up, which is a dynamic stretching, is very essential before an exercise to increase the lubrication of your joints and prepare your body for the exertion of exercise.
Sugar contributes to obesity.
Yes.
Yoga can improve posture.
Any kind of movement form done under the guidance of a trained professional will improve your posture.
Walking is a good form of exercise.
Yes.
All fat should be avoided in a diet.
No. We need fat for digesting and absorbing all the fat-soluble vitamins.
Posture affects confidence levels.
Yes, it does. It increases your testosterone levels. If the posture is right, it boosts your confidence and your self-esteem.
High protein diets can be harmful for kidney.
Very high protein diet, but as Indians, all of us are in a deficit of protein. We hardly intake 1/4 the requirement of protein.
Oh.
So for Indians, there's no such thing as a high protein diet.
Is it safe to exercise daily without a rest day?
We are born.
All 7 days we can do exercise.
We are born to move. We need to move every single day. You can walk, you can swim, you can run, you can go to the gym, you can do functional fitness, body weight exercises, yoga, sit down on the floor, play with your children, take the dog for a walk, move every day.
Supplements are necessary for good health.
Depends on the absorption capacities of your digestive system, or if you have any systemic conditions, do a blood work and then see which supplements are required for your specific body type.
Exercise alone can help in managing diabetes.
No, food plays a very integral part for controlling the type 2 diabetes.
Sleeping position influences the posture.
Not really.
Junk food is addictive.
It is highly addictive because it triggers the reward center in the brain to release dopamine, which in turn gives you the feeling of pleasure, which is addictive.
Fruits can be eaten with meals.
Yes, it can be eaten with meals depending on the type of movement you are doing before or after the meal.
Can we drink water while eating? Especially people say during lunch or during dinner, during meals, we should not take water.
You should not be taking water because it will dilute the hydrochloric acid in the stomach, which is meant for digestion of your food.
How about buttermilk instead of water?
That's again milk. It should be taken at least 45 minutes before or after the meal.
Not during the meal.
Not during the meal.
Is 15 minutes or 20 minutes or 10 minutes walking post-meal necessary?
Definitely, because that will prevent the insulin spike, improve your metabolism, help in digestion, reduce bloating, increase calorie burn, make you lose weight.
Thank you very much for coming on Aarogyam Katta.
अगर आपको ये वीडियो पसंद आया हो तो चैनल को सब्सक्राइब करें और लाइक करना ना भूलें। अगर आप किसी विषय पर और जानकारी चाहते हैं तो कमेंट में लिखें ताकि हम आपकी पसंद की वीडियो बना सकें।